clinical success, adhesive, rigid trays, high quality material, temporization with low shrink, occlusion, contacts maintained, moisture control, hemostatic control. What are we going to use? Let's talk about this material, which I use, and I also scan as well. This is NoCord VPS from Centrix, and it is priority. It is a next generation material because it's one-step, self-retracting, impressioning material that's very accurate. What it does, it makes impression taking easier, more predictable, less steps without retraction and hemostatic agents. NoCord contains a hemostatic agent in the wash and with a megamix material that drives the wash material and expands the sulcus at the same time. If you look at what happens here, this revolutionary material retracts the gingiva, stops the fluid flow, controls the bleeding, eliminates certain criteria, certain steps. The wash contains 15% aluminum to constrict the capillary oozing, controls the bleeding, displaces the crevicular fluids, and you get a predictable surface. Now, I'm not saying you need to be sloppy. Can't say that. This is not going to get you out of a jam, but there's a method of doing this NoCord material. Sometimes you can't scan. You have to do it. Let's look at my cases with NoCord. And I photographed the very first case I had with NoCord. I'm an evaluator, I'm a teacher, I'm a inquisitive person. Under no conditions will any technology, scanners, microhybrid composites, any finishers and polishers ever get you to a standards of excellence unless you adhere to the strict regime, regimented, predictable sequencing of either direct restorative, indirect restorative, scanning, implants, whatever. Let's look at cases with NoCord. Okay, here's a bridge. Obviously, I'm going to do a bridge, fixed bridge, taking apart some PFMs, and let's see what happens. Okay. Take apart the PFMs, obviously causing gingival irritation. One could see this, and you could either grab the laser, you could grab some hemostatic agents, and let's see what happens with NoCord. Well, when I first injected NoCord, I'll tell you how to do this. I said, okay, this is looks familiar. I don't know what to expect, but I've seen this movie before where you inject around materials around the teeth, and let's see what happens. Have the patient close, not bite, close into the impression tray, and then let's see about this hydraulic flow in driving this impression material and stopping the bleeding. Well, this is my very first impression. Not bad. A lot of great detail, great marginal adaptation, integrity, and no sign of any bleeding, even though there is bleeding in that environment.